Delirium is a disturbance in attention, awareness, and cognition that develops over a short period of time and represents a change from baseline. Estimates on the cost of delirium in the U.S. healthcare system have been as high as $152 billion annually. More importantly, there is serious morbidity and mortality risks for this condition that can often be avoided or dampened in severity. When it comes to delirium, the best strategy is prevention. In this quality improvement project, we examined how implementing a delirium precaution sign impacted adherence to care recommendations to prevent and address delirium. Additionally, care team members were surveyed after the observational data was collected to examine how staff felt about the sign. Over roughly a 2-month period, nursing staff on the 3 South Wing at Good Samaritan Regional Medical Center were asked to place the proposed sign outside of patient rooms for patients over the age of 65 years, or if they had already been deemed to have delirium. Observational surveys were then conducted periodically to assess use of the sign and adherence to some of the recommendations listed on the sign. Although the findings were not statistically significant, patients who had a delirium precaution sign had better care adherence in 2 of the 3 areas of interest, which suggests that the signs did make a difference. To examine how receptive staff were to the sign, anonymous surveys were used to ask physicians, nurses, CNAs, and support staff about their experience with the sign. Of those who noticed the sign, 45% agreed that they learned something from them. 57% of staff agreed that the delirium signs were beneficial to patient care, and this was highest for physicians and lowest for nurses and CNAs. Investigators theorized that physicians may have preferred the sign more than other professions due to promotion of least invasive interventions for delirium prevention and management. When looking at the observational data and survey responses together, it suggests that the use of a delirium precaution sign was beneficial to patient care. Since this was our first test of such a sign, we think that future trials on other units to get a larger sample size would be helpful prior to a hospital-wide implementation. We also think that educational talks could be provided to help improve staff knowledge and care for patients at risk for delirium. To see our delirium precaution sign, please scan the QR code on our poster.